Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Welcome back to Let's Clear the Air, all things allergy, asthma, and immunology. I'm your host, Liz Edwards, and today I am joined by Dr. Mike Norvell. It's great to be with you today. We are talking about biologics, and I think it's important for people to remember that you all have so many tools in the tool belt when it comes to treating allergies and asthma. But we hear a lot about biologic medications, and we'd like to know more. So can you walk us through what they are?
Sure thing. Yeah, most people probably have seen commercials regarding biologic medications for a number of years now. We began using them regularly, I'd say back in 2010, when the first product for our area came out, which was known as omalizumab or Xolair, and we used that to treat asthma. It really started us off on a really fast developing path, because after Xolair, we had multiple other biologic medications that gained approval for asthma, medications such as Fasenra, Nucala, Dupixent, Tezspire. And that is just in regards to treating asthma. What they found was that a variety of these medications, in addition to others, were effective in treating other conditions that we also see as allergists. And importantly, I think just to give people a bird's eye view, when we use the term biologic, I would think of it in terms of, when we take a medication, a pill, an IV, anything that we're taking a medication for to treat a medical condition, we're essentially giving somebody a chemical of some sort to initiate a response. So we found that over the last number of decades, we can give people a variety of different medications in different classes, for example, to lower their blood pressure. It operates on blood vessels, some operate on kidneys and different areas. Well, when we're talking about a biologic medication, we're not really talking about giving somebody a chemical to initiate a response. What we're using are molecularly engineered products, for the most part, that operate on a very small scale. So going back to Xolair, which is what I first mentioned, we're talking about using an antibody against an antibody, which is IgE, to take that antibody out of play, which they found that resulted in dramatic improvement in their asthma control. Most importantly, I think for a lot of us, what we found is we've used these therapies, we found them to be in our category of medicine. So in the allergy asthma field, they're very safe. If you even go back to the commercials that you'll see on television, the number of side effects that are listed for biologic medications used in allergy and asthma, those safety profiles are dramatically superior to some that are used, for example, in the rheumatology space. So to treat rheumatoid arthritis or ulcerative colitis or Crohn's disease, ours are much safer when you look at the adverse effect profile. In addition to the safety being strong, it allows us to be able to get control of your asthma without having to put you on high-dose steroids, which saves you from all of the adverse effects that you see from having to take steroids for years at a time, which was pretty much the standard of care for decades prior to these medicines being approved.
At what point do you put a patient on biologics? What thresholds do we have to cross to get to this point?
Yeah, so because of the cost of these medications, the insurance companies act as a gatekeeper, and I don't blame them. If you can get by on safer, cheaper alternative medication, that's fine. But what we find is that if you're having to use your rescue inhaler on a regular basis, your doctor is going to start you on typically an inhaled corticosteroid. As those doses start getting higher, and as you start having to add additional medications in addition to the steroids, what we have found is that not only is it cost effective, but it's also safe to be able to put somebody on a medication such as Xolair, which is what treats allergic asthma, And then I mentioned before, Nucala, Fasenra, Dupixent, those are indicated to treat eosinophilic asthma. And then you have Tezspire that we oftentimes use in cases of mixed or allergic and eosinophilic asthma. We don't have to monitor serum biomarkers to show that medication is necessary.
How are these medications given?
The ones that I've mentioned up to this point are all by injection. There is a biologic that we have used and still use for asthma that is an infusion. It's used less frequently just because we have gotten to the point now to where the safety has proven to be so superior that most of the ones I mentioned already have auto injectors or at-home administration available. Mm-hmm. So the injections can be given at home, or some people just don't like to give themselves injections at home, or they're not comfortable, and I understand that. They find it that they prefer to get it in our office, and all of our offices have that capability and are happy to do that. There is one little niche area that I've found skincare is effective and have used that. And when we need to set that up, our offices, we do have a few offices that have infusion capability, and we can utilize that as well. Going outside of the asthma area, we also use, as allergists, we use biologics to treat atopic dermatitis or eczema. We use it to treat nasal polyps. We use it to treat chronic urticaria. We use it to treat eosinophilic esophagitis. We use it to treat food allergies. So there's a broad umbrella of conditions that we have been able to utilize these therapies in and found them to be very effective. Some of those we're not there yet. There's one you asked how it was administered. There's an oral biologic that I believe, based on the data and what I'm hearing is going to be out later this year, shows to be very safe to treat chronic urticaria. We don't have an oral yet for asthma use.
Okay. You said the buzzword, food allergies. Can you talk a little bit more about that? That's one of the latest indications to come about in this world of biologics.
Yeah, so omalizumab or Xolair was approved by the FDA to treat food allergies, both isolated and multiple food allergies. We use it in young children and adults, and it's been shown, it's the one thing that we make very clear to our patients. Using this therapy is not designed to allow you to eat a food that you're allergic to. It is utilized to keep you safe in those cases where there may be an accidental exposure, and it could keep you from having a very bad outcome.
I think that's very important because there are a whole lot of other studies and trials going on with like desensitization happening, especially in the peanut allergic world. But you touched upon that, and that is very important to keep in mind, especially as a parent. But it does bring peace of mind, especially with a child in a school setting with accidental exposure, which is almost inevitable.
Yeah, kids going into school. And also, I found a lot of parents that are even more concerned with their teenager, young adult going off to college, having severe food allergies. Yeah. I remember when my kids were that age and sending them off into the great unknown. My children didn't have food allergies, but it's one less thing that you have to have weighing on you if you know that there's a therapy that can act as that safety blanket should it be necessary.
And I think it's also important to mention what we offer. We have people in our office that will help with insurance, and I say help with insurance. They will help navigate the paperwork. So from the time you prescribe me Xolair, we then have a team that will help with the insurance and the billing and how it all plays out.
Yeah, there are some really capable people that get involved on the front end. If somebody were to come in today and their condition warranted being placed on one of these biologic therapies, we would educate them on the product. We would talk about how best to deliver the product. And then we would get them to fill out the paperwork, submit that, and start that process. And there would be communication back and forth should there be any issues. It's a very important point to note.
And it's great because it's transparency, so you know upfront what you're getting into. This has been very eye-opening. I appreciate you taking the time with us today, Dr. Norvell. We've never just walked through all of the opportunities that are available with Biologics. So we thank you so much for being with us today.
Absolutely. Thank you so much.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.